Hello, this is Katia, your midwife. As you know, I'm also lactation consultant, and today's video is going to be about one of my favorite topics, which is infant feeding. And in particular, we're going to explore hand expressing. What is hand expressing? This is a technique to collect your colostrum or breast milk by hand. And by hand, I mean that you're going to squeeze your breast in order to obtain a certain amount of milk to be given to the baby. Why would you do that? In the antenatal period, so before the baby is born, you may want to do it from around 36 or 37 weeks, depending on the local hospital's policy. If you've been diagnosed with a medical condition, then that requires the baby to have the blood sugars checked, and that could be most of the times mainly would be gestational diabetes, or if you have a pre-existing diabetes. So if you have type 1 or type 2 diabetes before you get pregnant, you may need to express, it is advised to express your colostrum in order to help the baby's blood sugar to stay stable. After the baby's born, you may still need to hand express your colostrum. First of all, because probably the baby again needs a little kick to help those blood sugars to stay at a normal level, within a normal range. Or, for example, if you're separated from your baby because baby is unexpectedly admitted to the neonatal unit, and obviously for a while they might not be able to breastfeed. Or, for example, if the baby is struggling to latch on the breast or is reluctant to feed, so obviously they need to be fed somehow. So how do you do that? So the key is that you are relaxed and you try and make sure that your brain is in a position where you have mainly happy thoughts and positive thoughts. I know it could be quite difficult, especially if your baby is separated from you and is next door to the neonatal unit. But remember that the main hormones that help you produce colostrum and help increase the milk supply are prolactin and oxytocin. So if they have any disruptions with, for example, the increase of cortisol, which is one of the stress hormones, then obviously the milk supply can be reduced if there is too much stress around you. So the main thing is to try and be relaxed and think about positive things. So, for example, if your baby is next door in neonatal unit, they would normally give you a picture of the baby, or they would give you a little woolen cloth where your baby was sleeping on, so you can smell the baby, and you can then activate those feeling good hormones. And then obviously if you take pictures of the baby, videos of the baby, and you look at them while you're hand expressing, it could help to relax you more and to produce these feeling good hormones. So the main thing is that you feel comfortable and you are as relaxed as you could be. So if you're at home in the antenatal period or also postnatally, so after a baby's born and you're still in hospital or you've gone home, make sure that you're sitting somewhere comfortable, okay? Once you've done that, you can apply some warmth on your breast. So you need to expose your breast and you can apply some warmth. So it could be a warm pack, a warm compress, or a hot water bottle which is wrapped in a towel so you avoid burning your skin. And then after you apply the warmth, you can start massaging your breast. So you massage your breast either with your flat hand and you go around the whole breast, or with a fist like this, and you go from top to the nipple. Okay, this is technique, and you do it for about 5 to 10 minutes. This helps to relax all the muscles around the milk ducts and around the breast. Anyway, after you've done with the massage, you place your hands in a nice wide C shape above the areola. So the areola is the darker part around the nipple. And why is that? Because from around a couple of centimeters, 1 to 2 centimeters from the areola up until the nipple, that's where the milk ducts start. So the milk ducts is basically the piping system of your breast. Above the pipes, there are the storage tanks. The storage tanks are called alveoli, and that's the part of the breast tissue where actually the milk is produced and stored. So if you're holding a squeezy bottle, obviously, and you want to squirt the liquid out of it, obviously we want to squeeze where the liquid is, not where the piping are, because basically what's going to happen if you're going to press here on the nipple, and this is the immediate reaction of everyone wanting to hand express, you're just going to close the pipes. So imagine you have a balloon like this one, and you remove the knot, you undo the knot. So if you want the air not to come out, you just want to squeeze here. Instead, if you don't care about the air coming out, you can hold the balloon anywhere, you can squeeze here, the air is still coming out. Actually, it's coming out even faster. So that's the same thing with the breast. So you express from here above the areola, and you squeeze like this. In terms of how strongly, or anyway, in terms of pressure, that's something that's up to you, because obviously you don't want to end up with bruised breasts, but you don't want to put not enough pressure not to obtain anything. So the first time you do it, especially in the antenatal period, you may not have big amounts coming out, or anyway, you may not see anything coming out for the first couple of times that you do it. Sometimes it may take up to 7 to 10 minutes to start seeing specks of colostrum, or anyway to start seeing bigger drops coming out. But anyway, as soon as the main thing is that you perfect your technique in order to make sure and feel confident when you will need to hand express, if you will need to hand express more. Obviously, after the baby's born, you're going to have that big rush of hormones that will help things getting easier. And obviously, if you keep the baby skin to skin, if you offer the breast and you try and feed the baby, that will all help to increase the milk supply. So don't give up on that. But in the antenatal period, the first couple of days could be a bit of a rocky start, but don't be disheartened. How do I collect the milk? So if you're at home and your baby's already born and you don't have much fancy equipment, you can use just a clean spoon. You just need to wash it with hot water and washing up liquid. If you want to sterilize it, you can use a sterilizing liquid, but then you need to rinse it, or otherwise you can just boil it and let it air dry, so it will be nice and clean. So when you're expressing, you just place the spoon underneath the breast and you collect the colostrum, and you can give it to the baby straight away using the spoon. Obviously, you may need supervision, you may need to be explained by a lactation consultant or by a midwife, which would be the safe technique. Again, if you're at home and you already have good amounts of colostrum or breast milk, you can use a little cup like this one. This is a plastic cup, but you can use like a small mug, like this Italian coffee cups. As long as they're clean, it's fine. They don't have to be sterile. So you place them underneath the breast and you collect the milk. And this is much easier because you've got a bigger outlet, so at least you can catch all the drops. If you're in hospital or you're in your antenatal period and you've been told that you need to hand express before the baby is born, then you will probably be given, most likely you will be given a kit which consists in a few special syringes. Normally they would be from 1 milliliter to up to 3 or 5 milliliters, and they have a purple plunger and a slightly bigger tip compared to a normal syringe, because you don't need to put a needle, and you use that bigger outlet to collect the drops. So obviously, if you have a large breast, you may not see what you're doing, so you may want to use your partner to help you out collecting the milk. Otherwise, just a cup or a clean spoon will do. How do you store it? If you have syringes, you will be given stoppers to close the syringes at the end of the day or at the end of the expressing session, and you can store them in the fridge. Home fridge up to 72 hours, hospital fridge up to 48 hours, and then in the freezer up to 3 or 6 months, depending on what kind of freezer you have. And then if you have larger amount of breast milk, you can use some, there are some milk storage jars, plastic jars, so you can use a normal glass jar if you want to put it in the fridge, or for example there are special sterile bags to store breast milk. So you can, there is quite a few things that you could use to store your breast milk, and then how to give it to the baby is going to be part of another tutorial. So if you found this video useful and interesting, just please share it with your friends, like my page, Your Midwife UK, and if you have any questions or any concerns, or you would like more information about this technique, please put a comment underneath my video or send me a private message. Until next time, bye bye.